Okay, coming to the next part of our case history, that is general examination. Usually some of the points were most commonly used in almost all the departments, that is build, posture, nourishment and even orientation. Coming to the build, according to Shelton classification, there are three types of build, that is ectomorphic, endomorphic and mesomorphic. Who are ectomorphic? Ectomorphic are thin and tall persons, and endomorphic are short and obese persons, and mesomorphic are muscular. So these are the three classifications given by Sheldon. Okay, now coming to the next classification, that is given by Krishman. According to him, there are various classifications like asthenic, stephenic, hyposthenic, picnic and also finally cachexia. So coming to this, cachexia means it is a malnourished persons and they will be having a low muscular mass. And coming to the next one, that is asthenic, they are thin lean persons, and hyposthenic is usually in an athletic form. And coming to the picnic, they are usually rounded in structure and they will be having a high amount of muscular and also visceral fat will be higher in nature for these persons. So these are the two classifications by which the person is said to be what is the build of the particular patient. So coming to the next one, usually you can write, so according to the nourishment, by seeing the patient also you can see what is the nourishment of the patient. So usually you will be writing a well nourished and orientation of the patient, whether he is able to answer to the questions which you are asking to the patient. So this is with respect to nourishment and orientation. Coming to the next one, posture. Why posture is asked in case history and how it is related with our dental. So coming to posture, you may know what is that forward bending and sideward bending, that is scoliosis or kyphosis. Actually it is proven by an article which you can see on my back, that is even the abnormal postures can lead to dental malocclusions like overjet, and the sagittal plane can also be changed due to the abnormal postures like kyphosis or scoliosis. So coming to the next point or the next examination is gait. So what is gait? It is usually the way a person walks, how the person is walking, that is gait. And you will be asked what are the various type of gaits, you know, that is like spastic, which can be seen in Parkinsonism, and coming to the next one, that is waddling type of gait, which can be seen in myasthenia gravis, as well as in conditions where the hip joint or the waist joint got broken. So, and coming to the next point, like scissors gait, which is of most important to the dental point of view, because we all know in skeletal fluorosis, that is in more than 4 ppm of fluoride or even in 7 or 8 ppm of fluoride, skeletal fluorosis can occur. In that condition, we all know joint will get stiffened, and in that case, usually the person in the skeletal fluorosis, they will be having a pattern of walk where the right leg will be going over the left leg during their walk, which will look like scissors. So scissors gait is of importance to dental point of view due to skeletal fluorosis. Also another various types like Trendelenburg, propulsive, these are another types, even hemiplegic type. So this covers with gait. Coming to the next aspect, that is there are two signs which you can see. One is vital signs and the other one is constitutional signs. What are the vital signs? As we all know, that is pulse rate, respiratory rate, blood pressure and finally temperature. Coming to the pulse rate, which is easy for us to carry out, that is everyone will know where is the radial artery. Usually we will be using the two fingers, like the index finger and the next one, the middle finger, by palpating the upper radial artery in the wrist part. So usually you will be calculating rate, rhythm, volume in radial pulse. So usually the pulse will be between 60 to 100 beats per minute. And coming to the next one, that is respiratory rate. Usually the respiratory rate is common for that is 14 to 18. So this is one inspiration and a expiration which you can see in the abdomen of the patient, and that is one inspiration and expiration makes one respiratory rate. So the normal is 14 to 18 inspirations or respirations per minute. So coming to the next one, that is blood pressure. Usually if you are not provided with a sphygmomanometer, you can say or write it as not recorded, and in the same case, that is with the temperature, if you are not provided with a thermometer, you can write it as not recorded. Don't write like 36 or 98, that is normal, or afebrile like that, because if you are not provided with the instrument, you can simply write as not recorded. Coming to the next one, that is BMI, that is body mass index. This you can see in many of the malls, or even when you are going to many hospitals, you can see there is a BMI calculating machine. But usually even you can simply calculate your body mass index by a simple formula given by Adolf Belgian Polymer Kuetler. Quetelet is the person who gave body mass index formula, that is weight which is calculated in kilograms divided by height in meter square. Usually you will be having a height and weight machine in your department or in your hospital premises, that will be in centimeters. For example, if I am weighing 70 kilograms and my height is 175, it is in centimeters, but you have to calculate in meters. So put a dot, 1.75 into 1.75. So 70 in kilograms divided by my height. The centimeters covered in meters, that is 1.75 into 1.75, and I will be getting a value. So the final classification will be like below 18.5 it is calculated that underweight, and 18.6 to 25 that is 24.9 is calculated as normal. Above 25 to 29.9 that is overweight, and 30 and above is classified as obese. So this is given by Adolf Kuetler. This is for body mass index. So these are the various vital signs you should calculate in case history. And finally coming to the next one, that is constitutional signs. What are the constitutional signs you will be usually asking or you will be examining the patient? The first one is clubbing. So what is clubbing? Usually clubbing is defined as the bulbous enlargement of the soft tissue or the terminal end of the phalanges of the fingers. So how you will be seeing? That is by an experiment or a sign called Shamrock sign. And what is that? Usually for all the persons you can see by placing the thumb like this, and you can see a diamond shape. But for the clubbing patients, they will not be having that due to the bulbous enlargement. They can't see the diamond shape, and this is called Shamrock sign. And usually you will be asked with another point, that is Loewe-Bond angle. Usually for a normal persons, the angle will be less than 180 degree, not for the persons who are having the sign of clubbing. So what are the various causes for clubbing? Say you can cardiac causes like cyanotic congenital heart diseases, and in the respiratory conditions like bronchiectasis, lung abscess. And also in some conditions like acromegaly and myxedema, also you can see clubbing. There is another concept called pseudo clubbing, which is most commonly seen in hyperthyroid patients, where you can see a characteristic drumstick-like appearance for those patients. So this is with respect to clubbing. So Shamrock sign, Loewe-Bond angle, drumstick appearance. These are the important points you should know in clubbing. Coming to the next one, that is cyanosis. Define cyanosis. This is bluish discoloration of the skin and the mucous membrane, which is due to increased quantity of reduced hemoglobin. Increased quantity of reduced hemoglobin, usually that is more than 5 milligram percentage. So this is called cyanosis. Where you will be seeing the cyanosis? Usually you can see it in the tip of the tongue, also in the nail beds, also in the skin of the face and the palms. So again it is classified into two types, that is one is a central and another one is a peripheral. Coming to the central cyanosis, that is usually due to again the cardiac causes like cyanotic congenital heart diseases, and in the respiratory diseases like chronic obstructive pulmonary disease. So these are the conditions for which the central cyanosis can happen, and for peripheral cyanosis it may be due to cold conditions, also even due to the jewelry which is very tight. This can cause with the peripheral cyanosis. Coming to the next one, that is icterus or the jaundice. So as I say, for cyanosis the blue is discoloration. Jaundice, everyone knows, that is yellowish discoloration of the skinner's mucous membrane, which is due to increase in the bilirubin content. What is the normal bilirubin content, which is mostly around 1 milligram per deciliter, but for the jaundice patients or the icteric condition, it is more than 2 to 3 milligram per deciliter. So again, jaundice where you can see mostly in the nail beds, also you can see it in the faces, also in sclera of the eyeball. So mostly you can see in the sclera of the eyeball for jaundice patients. And also you can be asked what are the three types, like hepatocellular, cholecystic and hepatic. So these are the three conditions, liver conditions in which jaundice can occur. So these are the various signs and the findings you are going to ask in general examination. After finishing with general examination, we shall proceed to oral cavity. That is first starting with extraoral, then we can go to the intraoral. Coming to the extraoral, so what are the points which you will be highlighting? That is facial symmetry. Facial symmetry, unless otherwise if the patient is having any developmental disorders or developmental bone problems like cherubism, Paget's disease, or even osteoarthritis deformance. Otherwise, usually the patient will be having a bilateral symmetry. This you can write. Or even with the abscess, or even during fracture condition, the symmetrical can go. Otherwise, you can write it as bilateral symmetrical. Coming to the next one, that is facial profile. For seeing facial profile, you will know 3 points like glabella, which you can see in the between the eyebrows, and the most anterior point of the chin, that is soft tissue point A or B. So soft tissue point A is the deepest curvature in the upper lip, which is also called as philtrum. So this is the second point. So starting with glabella, second one is the soft tissue point A, that is deepest curvature in the upper lip, philtrum, and the third point is the soft tissue point B, that is the most anterior point of the chin, that is pogonium. By drawing an imaginary line between these 3 points, you can see whether the patient is having a straight profile or a convex type of profile or a concave type of profile. With that you can relate with the class 2 or a class 3 type of malocclusion. So this is with respect to the facial profile. Coming to the next one, that is lips. So what are the various types of lips you can see? Usually the normal lip seal is formed, that is competent. So the lips are small, so the patient is not able to form a lip seal. So that is incompetent lips. But the patient is having a normal lips, but due to the proclined anteriors, maxillary anteriors, the patient is not able to form a lip seal. With the increase in the activity of the muscles, the patient will be able to form a lip seal, that is called potentially competent lips. There is also another form, that is everted type of lips, that is hypertrophic lips. So this is the various forms with respect to lips. Also, again you can go with respect to the another point like mouth opening. Usually you will be designing with the help of a divider. You should be calculating interincisal distance. The normal interincisal distance is 35 to 45 millimeter. So some persons will be saying 3 finger breadth, but in a clinical point of view, you should have a divider and measure with the interincisal edge. So this is for mouth opening. And coming to the TMJ and lymph nodes, Dr. Vishal will be explaining it.
Next, coming to the TMJ examination. Usually TMJ examination is done by palpation. It can be palpated in the pre-tragus area, also called as extra-auricular method, and by intra-auricular method. First, palpation of the pre-tragus area or extra-auricular method. The examiner should be placed either in front or behind the patient. Patient is asked to slowly open and close the mouth, palpating with index finger placed in the pre-tragus depression. And the another method, palpating the intra-auricular area, performing by inserting small finger into the ear canal and pressing anteriorly. While palpating with this method, check whether condyle moves symmetrically with the rotation and translation phase. In both the methods, bidigital palpation of the TMJ should be done. In the TMJ examination, examiner should check for tenderness, clicking or popping, usually associated with mouth opening and closing, and crepitus or grating sound, which indicates advanced TMJ damage like degenerative changes. Next, coming to the lymph nodes. We all know lymph nodes are oval structures draining the different body parts. Normally, they are non-tender, soft and cannot be felt even if they are present. While examining the lymph nodes, tender on palpation and mobility of the lymph nodes should be noted. In dental point of view, we should check for post-auricular lymph nodes, pre-auricular lymph nodes, submental and submandibular lymph nodes, and cervical lymph nodes. First, post-auricular lymph nodes. These lymph nodes are present behind the ear near the insertion of the sternocleidomastoid. By a digital palpation is done by pressing against the skull. Enlarged post-auricular lymph nodes indicates infection of the scalp, temporal and frontal area. And the second one, pre-auricular lymph nodes. It can be palpated in front of the ear. Enlarged pre-auricular lymph nodes indicates infection of the ear. Next, submental lymph node, which can be located below the chin. It can be palpated by rolling the fingers below and lingual to the chin against the mylohyoid muscle, enlarged in disorders in the anterior portion of the mouth and the lower lip. Next, coming to the submandibular lymph nodes, where the submandibular lymph nodes drains tongue, submaxillary gland, lips and mouth. Submandibular lymph nodes located medial to the inferior border of mandible. It can be palpated by rolling the fingers against the inner surface of mandible with patient head gently tilted towards one side. Enlarged submandibular lymph node indicates infections of the head, neck, sinuses, ear, eyes, scalp and pharynx. Next, the cervical lymph nodes. Anterior and posterior cervical lymph nodes are present. Anterior chain of cervical lymph nodes can be palpated medial to the sternocleidomastoid muscle. And for palpation of the posterior cervical lymph nodes, palpation starts with the trapezius muscle and move to the sternocleidomastoid.